Welcome to Skin Deep with
Mary
and Diana. Hey everybody, I know it's been a minute, but we're back. We're going to talk about
microneedling today.
Microneedling for two good reasons. One, because we're having a huge special on it right now. You can go to our website and check it out. And then number two, it's the perfect time of year to get a treatment done, and I'm going to get one tomorrow morning with lovely Ashley. So we will actually we'll include a little video of that as well, and I'm super excited about that. So I have a few questions for Mary.
Yes.
I know there's a lot of questions about microneedling.
Absolutely. And
it's
just
kind of
to
confusing.
fill you all in, our microneedling platform is the Genius. So
Genius
if we say the word Genius, that we're referring to our radio frequency microneedling. Just wanted to throw that out there too.
Okay, what does radio frequency microneedling treat?
So it is used for scars. It's used for textural abnormalities in the skin. So deep wrinkles.
I've got like a little dimpling on my chin that's starting.
Yep, yeah. It's good for that kind of thing. It's good for enlarged pores. You're going to get like a tightening and lifting effect with it. So lots of benefits to radio frequency microneedling.
It goes under the eye. You can get pretty close under the eye.
And it's also, because it creates these channels in the skin, it also makes it an ideal time to apply any sort of topicals that you really want to drive into the skin.
Okay, how is RF, radio frequency microneedling, different than traditional microneedling?
Yeah, good question. So they both use needles to create wounds in the skin, and the wound response is what is going to stimulate more elastin and collagen. It's going to be what's responsible for the skin remodeling. The difference is that the RF microneedling, shocker, includes RF radio frequency. And why is that important? Well, when we heat the tissue, we get these coagulation zones, and that is going to create more remodeling. And you're going to get this sort of like, almost like shrink wrap effect, like a tightening effect from that heat, some contraction. So you're just going to get a more enhanced result. Now, if you're 25 years old and you have acne scarring, you can do traditional microneedling and really even out the texture of the skin with just that regular microneedling. It's a cheaper price point.
Yeah.
But if you want to get a little bit more, you want that
entry
lift.
Level.
Yeah.
Entry level, and then you have the advanced.
That lifting, tightening, volumization is going to come more from the RF. Yeah.
Right. Well, because at the end of the day, you want a controlled injury.
Yes.
And so you are going to get that with a traditional microneedling pen.
That's right.
Right.
Yep.
But you're just going to like the big guns.
Yeah. You're adding another point of wound because it's like heat and needle, so it's like double whammy.
It's like double whammy. And if you're gonna be down for the count and out for a few days, for me anyway, I might as well go big or go home.
Exactly, and honestly,
but they're both fantastic.
And it's not even, the downtime isn't even that much with it. It's like 1 to 2 days kind of thing.
It's not bad at all.
Yeah.
Oh, there's another question. Hold on. Let's see. Are all radio frequency devices considered equal? I think this is a really good question because it's kind of overwhelming when you go online.
Oh, absolutely. I mean, no. The answer is no. There are a lot of different types out there. There's ones with insulated needles. There's ones with non-insulated needles. The Genius happens to have insulated needles. Why is that important to me? Well, if the needle's insulated, it goes into the skin, bypasses the epidermis, and it doesn't fire that energy until it's under the skin.
Okay.
Whereas a non-insulated needle, it's gonna go through the epidermis with heat and create more hyperpigmentation, a higher possibility of inducing melasma, not as safe for dark skin types.
That's big.
So yeah. So in like the way I look at it is, do the insulated needles, get that remodeling at the deeper level, and then if you still want to do something to the surface, you can follow up with the ultra, and that's going to treat the surface. So I like that approach because then I know that I can be safer with like darker skin types, people prone to melasma.
Yeah.
Other thing that separates the Genius from other ones is it has this high torque motor in the handpiece. When I tell you that's important, oh my gosh, I have had RF microneedling with other devices that feel like staplers. That high torque and they use proprietary sharper needles, it makes a really big difference. I've had other ones in my hands and really it feels like a stapler. There's like a spring and the needles aren't as sharp and it's a lot more traumatic.
We know the other device that's out there. That's kind of scared a lot of people.
Yes.
It begins with an M.
And it is more painful. And then also the needles on that can go up to 8 millimeters. And that's where we're getting a little bit of a bad name with RF microneedling is people are like, oh, is it melting fat? Well, at 1.5 to 3 millimeters, which is typically where we are. Typically we're at like 1.5 to 2.5 millimeters with the Genius. That's kind of that sweet spot that we want to be in. You go down to 8 millimeters. That is deep, and that can affect the fat.
Yeah, affect the fat.
So
super painful.
Yeah, and so like you don't have to use it at 8 millimeters. I like to make sure that patients know that this is not going to go that deep, so it's
Super
not going to
safe.
affect their fat.
Yeah.
Final thing I want to say about what differentiates the Genius is that it has real-time feedback. So as I'm doing the treatment, it will tell me, it gives me a signal if there's impedance. If that energy isn't getting into your skin efficiently,
Which is huge.
then I know to lower the energy. Why is that important? Well, number one, it's just good for pain management. If I'm using the device and it's telling me, oh, that energy isn't really making it in there, I can lower it and the patient has a higher comfort level. But more importantly, it's important for protecting the skin, because if all that energy isn't really needed, then why risk additional damage, right?
And
so
it's just key to have that feedback. Like
exactly.
Real-time feedback.
Yeah, and it's also good for knowing for future treatments. So I like having that sort of, feedback that's why it's called the Genius, because it knows.
It knows, exactly. Yeah. Yay. Okay, well, yay.
Yay. And I look forward to seeing your results, and
we'll
see you tomorrow.
We'll take some photos, we'll do some before and afters, we'll show you kind of like the healing process, like how long it takes. I'll probably do the ultra on top of it for a double whammy.
Yeah.
But yeah, we'll keep you posted.
Cool.
Okay.
Bye.
Bye.
Come with me. We're going to do some microneedling with radio frequency on Diana.
Woohoo!